I went to university at University of Pennsylvania in Philadelphia, where coincidentally I met my wife there, and we've been happily married for 35 years this year. From there, I went to the Boston University. At BU, certainly getting into orthodontics is not an easy endeavor. It's a very competitive field, but I did continue my education straight out of dental school at BU to do the orthodontic training. Moved to South Florida, where my wife was from, right out of ortho training in 1986, and initially was an associate with Ray Greenfield, who has a great reputation and lectures internationally. And I associated with Ray for about 3 years. They weren't quite ready for me to become a partner, and even the senior partner, a pediatric dentist in the group, said, "Open your own, don't wait for me." And that's when we started Smiles by Dr. W. The nice sort of circle of my career is Ray went out on disability about 15 years ago, but I still do some of his research for him. So when he's testing new products or whatever, and we're in the middle of doing some research for him now, so that we get the clinical slides and get the information for him. Over the years, I've been involved in different capacities in continuing education. I'm past president of the South Florida Academy of Orthodontics, which is the Tri-County Study Club. So being on the board for there was really responsible for getting all the continuing education to come down here. Most recently, I've been on the board for SureSmile, which is a technique that we use in the office and probably the most technically advanced treatment, where we take the teeth, bring it into a computer, manipulate the teeth on the computer, and then a robot helps bend wire to move the teeth where we go. And it's been very satisfying being on that board and sort of pushing forward the advancement in the technology, which again ties into my engineering and my passion at doing the orthodontics. And then just the usual study clubs and being involved and working with other dentists in different capacities. And certainly most of the adult cases now have a multidisciplinary component to it, where you have to work and everyone has their own perspective. It's funny, one of my favorite quotes is, "The definition of a specialist is someone who knows more and more about less and less, so eventually you can know everything about nothing." So you can't be everything to everyone, and sometimes you have to collaborate with other experts that know things. And when we talk about these cases, it's nice because I have my perspective, others, but in the end, when the doctors all get together, it's really what's best for the patient.